In my childhood, I used to ask my grandma, did the Kurukshetra really exist? Was there any Abhimanyu really in Kurukshetra? She said, as you grow big, you will understand whether really it happened or not. But when we look at NEET PG exam, with 1,24,000 students fighting for 20,000 seats, there possibly would have been an existence of Kurukshetra really in the modern times, and that is NEET PG. And Abhimanyus also did exist, that is the young house surgeons who have half-baked their preparation. Exam of 300 questions looks like a jantar mantar, right? But the honest truth is, last 18 years we had been helping the students, mentoring them, around 2 lakh students to prepare for PG medical entrance. After every exam is over, there will be a common reaction. Oh, very easy question I missed. Oh, I would have read this topic. Oh, I have neglected this topic. After that, there will be an anger. Hey, this is all my exam. I am a brilliant guy. Why I have done wrong? Then everyone will say, maybe there is a scam. Maybe there is a paper leak. Maybe there will be a re-exam. After that, we all will settle down and accept the truth that paper is not tough. The topper is anyway cracking 80% score, 75% score. He is also a human being, right? So the only difference between the people who top and win and those who are embarrassed with a lost performance, the only difference is all are equally genius. That's the reason we all entered into medical school. There are only 650 most high yield topics from which 80% question paper comes. There are 50 completely impossible, idiotic MCQs that will be there in every exam. Especially when negative marking is there, if you try to jump greedily to catch those 50 otherwise impossible questions specially created to fix your life, then there are chances of destroying your chances to win. That's the reason most important decision with a negative marking exam like NEET PG is, you should know what examiner is trying to ask you. Is he trying to check whether you are wildly guessing and trying to answer like ABC, Kaun Banega Karodpati show? You will be eagerly trying to catch every question in order to win money. Please don't do that in NEET PG. So let's be ready for the NEET PG 2019 with all the grand lessons we learnt after taking the exam. So let's have a quick discussion on how we can sharpen our preparation. Within no time, once more AIMS PGI notifications will come, DNB will come. Once more, dekhte, next notification of NEET PG 2019 will also come. So there is a reason, there is a very little time to regret. So my call to advice to all the people who have not performed well the last NEET PG is, take a quick break, 10-15 days, breathe yourself well. Then decide a fine day and restart preparation. And if you finish housemanship and came out, join somewhere as a duty doctor so that you are in touch with the clinicals. 3-4 months you can still work and then you can start the preparation once more fully. But start preparation from at least February 1st week onwards. That is the goal. What is this muscle? What type of muscle is this? It's a multipennate. You should know that you have biceps brachii like fusiform muscles. Rectus abdominis has got parallel fibers. Spectralis major, he is having convergent fibers, and Palmar interosseous has got unipennate, and the rectus femoris is a bipennate, deltoid is multipennate, and the circularis oculi are the examples of the circular muscles is what you have to basically remember. Can the online students can punch whether the voice is loud and clear, right? From where are the nerves of the branchial arch derived? This is one of the standard questions regularly asked in every PG medical entrance. If you don't know, to vomit out 1, 2, 3, 4, 5, 6 neural crest derivatives, you are not prepared to exam at all. Spinal cord level answer karne wala question hai, neural crest derivative. So from the neural crest, the neurons, glia, cartilage, bone, connective tissue, sympathoadrenal cells, the pigment cells, the sensory neurons and the sensory glia, they all originate from the neural crest is what you have to basically remember. So till now, there is not much of tough question. They are all easy. Heart palate. What is the type of epithelium? One of the type of epithelium based question is a standard question in PG medical. So do you have that 650 topic list that we have given you? Please take that. At least top 50% topics if you can revise. 300 topics thoroughly if you can focus to revise. Anyway, we will do that in all our weekend classes, face-to-face classes, live online broadcasted classes, video library. All this we will provide to support your preparation. But you have to, there are certain things which are called donkey work for NEET PG preparation. We have no other way than to break our backs and do the donkey preparation. One of the things is type of epithelium is a favorite question of the examiner. So heart palate is keratinized, it has got a submucosa, there are minor salivary glands, it is a keratinizing stratified squamous epithelium which is the part of the hard palate is what you need to basically remember. Now what is the tensor of vocal cord? Vocal cord muscles. Is it any new topic? Standard topic. Everybody will crash this question. So cricothyroid. So abductors are lateral cricoarytenoid, relaxers are thyroarytenoid, and you have cricothyroid, which is the tensor of the vocal cord, is what you need to be very sure about. From where does ureteric bud develop? Once more. Mesonephric duct derivatives in embryology. Paramesonephric, Wolffian duct and the mesonephric duct derivatives. Every exam you go, invariably they will ask this question. So somebody said, oh, NEET PG was a very tough paper, sir. Simple questions only they look like, but very tough, sir. It was tough because if your preparation was not tough. If your preparation is tough, you are well equipped with all the high yield topics. Question paper is a skating, easiest paper on the planet Earth. I expected case based questions and some glorious image based questions, but they're all single liners, very easy questions, except 50 questions are impossible questions. If you tried that, you are losing marks or negative marking. And another 30 to 40 questions require thoda common sense situationally. Prepare hone se answer karne wala questions thodi hai. But 220 questions, 100% you can answer if you have prepared for the exam, taken the mock test regularly, participated in discussions of mock tests, and given some serious amount of time, right? So ureteric bud develops from mesonephros. You can see you have got a hindgut, mesonephric duct, mesonephros, and a metanephric blastema from which the ureteric bud is developing. So this development of the genitourinary system is one topic many times we discussed in our weekend classes. So you need to be very sure. Once more, All the brainstem syndromes you should know, doctor. Weber syndrome, there is an oculomotor palsy because midbrain is involved on the ipsilateral side, and contralateral side there is a hemiplegia which is called as Weber. So Weber syndrome, can you give me? North-Nagel syndrome, Parinaud syndrome, Foville syndrome, all these syndromes you must be very sure about. So what happens in the case of the Weber? You have a midbrain, then you have a pons, then you have a medulla. Agree? In the midbrain, what do you have? Third and fourth cranial nerve nuclei, oculomotor and trochlear. Fifth, sixth, seventh, up to facial are there in pons. Eighth, ninth, tenth, everything is there in medulla. So, whenever midbrain there is an infarction, then what is affected? Third cranial nerve is affected. Then, how does the pyramidal tract, what is corticospinal tract? From the brain, from the pyramidal cells of beds, the fibers pass to the internal capsule and they descend down the brainstem at the level of the lower medulla. They will decussate and go to the opposite side and serve the anterhorn cells, and when they stimulate them, right, there is contraction of the muscles. So whenever the midbrain, let us say on my right side, is affected, then what will happen? The third cranial nerve will become paralyzed. Same time, the descending corticospinal, which is called pyramidal tract, get affected, and that in turn will affect the opposite side. Hemiplegia will come. So this combination of third cranial nerve palsy ipsilateral and contralateral hemiplegia, because of the infarction in the midbrain, is basically called as Weber syndrome. So in our video library on the anatomy2medicine.com and in UMedico app, we have a clear 30-minute discussion on brainstem syndromes in the medicine, in the neurology folder. So please review. Definitely every exam you go, they will ask this question that in the Weber syndrome there will be contralateral hemiplegia, ipsilateral oculomotor, contralateral Parkinsonism. These are the ones which are typically happening in the Weber syndrome. You can see this patient of Weber, what happened to his eye? Laterally deviated because of oculomotor palsy. And this is another example of a patient who is having the typical Weber syndrome with oculomotor palsy ipsilaterally is what you need to basically remember. So what is Simpson's fascia? Simpson is a suprapleural membrane. So it basically has a attachment to the transverse process of the C7 vertebra. It is not to the second rib. So that is what you have to basically appreciate. It is the first costal cartilage to the transverse process of C7 vertebra. You are having the suprapleural membrane which is called as Simpson. Simpson is not expected, it is a common sense. Out of the 7 questions, 1 question only thoda away from the high yield topic list, right? I told you, 35 questions are, it's all your last janma gyan. You should be in a position to answer, right? 50 are idiotic questions. You don't try even to touch them if there is a negative marking. But 220 questions, sharp you should answer, right? Now, posterior inferior cerebral artery is called lateral medullary syndrome of Wellenberg. This is a oldest question on the planet Earth. Where is Broca's area? A question bhi hai kya? Huh? So, inferior frontal gyrus, you are having the Broca's, which is the motor area. Wernicke's is the one which is typically the one which is the receptive speech area. Broca's के वजह से हमारा स्पीच का आर्टिकुलेशन बनता है. Wernicke's की वजह से we can comprehend what others are speaking. right? So, if somebody has a Broca's aphasia, if you stand on the side of the bed of the patient and start talking, always be careful as house surgeons. We take very easy that the patient is not understanding. Hey, this cabbage, kya hai? Kab relief hota hai? I was betting, you know, my bet is correct that Broca's is the infarction in this fellow. Like that, if you are talking, patient understands. Broca's wala can understand. He won't take it that easily, right? He will be depressed. What this fellow, what kind of medical doctor he is so insensitive. He is treating me like a cabbage, right? Lot of times people, there is a great etiquette. Etiquette teaching is something that misses in most medical schools. Children will be fighting about jayedad, kaun share karna hai, before a Broca's paralyzed parent. Don't do that. If you do it before a Wernicke's, it's okay because they don't understand what you are doing. But Broca's can understand what you are talking. Only thing is he is unable to express, right? Expressive aphasia. So where is Broca's? Broca's is in the area Brodmann 44 is what need to be remembered. So what is this muscle and what is the function of this muscle? Lumbrical is the muscle which is being shown. Lumbrical ka action kaise yaad rakhega aap? Many times we discussed in our mock tests every Sunday. L shape lagao. L lagai to kya hota? Interphalangeals extend and metacarpophalangeal flex. This is what lumbrical's action is. It extends the interphalangeal and flexes the metacarpophalangeal is what you need to remember. So, just like pad, you know, no? Dorsal interossei, palmar interossei, what are they? Right? So, pad means palmar interossei, adduction and dorsal interossei, abduction. Dab and pad. Similarly, lumbricals ka what is the function? Right? Ulnar nerve, median nerve, radial nerve. Without that, there is no PG medical entrance exam. 100% you should be sure. Right? All median nerve, clinical examination, everything. Acute tonsillitis typically affects which nerve? So, this is the anatomy of the tonsillar bed. So, typically in the tonsillar bed, if you look at the glossopharyngeal gives a branch to stylopharyngeus, to carotid body and carotid sinus, and to the tongue, and also it will give rise to the sensation to palatine tonsil. So, that is the reason if you look at the typical tonsillar bed, you are having a glossopharyngeal nerve very close. That's the reason any tonsillar surgery can injure the glossopharyngeal is what you need to remember. Oh, this is from the days of pre-independent India. This question routinely is asked, diaphragmatic openings, right? Tata is the answer, right? So, what do you have? Tata, thoracic duct T, A is aorta, A is azygous vein, right? Is the typical contents. Thoracic duct, splanchnic nerve, aorta, azygous vein, right? Are the ones which you need to basically remember. Newly erupted tooth is covered by, unless your younger sister is a dental student and preparing for MDS, by mistake MDS question bank wala question MD question bank में आ गए तो ऐसा होता है, computer mistake, right? This is not the question for MD students. Forget about it. What is enamel, cuticle and all that. ये सब पढ़ने का हिम्मत नहीं है, इसलिए MBBS में join हुए ना हम. Now, what is the value of the BMI, which you can call lethal obesity? This is another impossible question, doctor. What is calculate Broca's index, Quicklect index and all that is fine. We are ready with the formulas. Lethal obesity means थोड़ा लेवल रहना. अगर मालूम नहीं है कुछ भी लगाएंगे बोले तो रैंक भी पतंग जैसे काट के चले जाता वैसे चले जाता रैंक. So be very sure. So BMI value of 13 is considered as lethal. But anyway, obesity is a high yielding topic, definitely. Right? What are the neurotransmitters involved in obesity? Right? Girl-in and all these things, they very frequently asked. So class 3 obesity is a morbid form where the BMI is more than 40 kg per meter square, and it is considered lethal for men is 13, and females can withstand and survive at lower BMI rate up to 11. So that's what you need to, so normal weight is 18.5 to 24.9 is the normal BMI value, right? So if it is lethal, it is considered to be lethal for men. If it is too less is also too bad. I mean, we are talking on the other side of the malnutrition, not obesity, but anorexia. Now, in myasthenia gravis, I think cheapest question on the planet. At least examiner is not asking is it nicotinic receptor or muscarinic receptor, nicotinic, right? Then what is the characteristic pattern of Brown sequence? This is one of the oldest questions on the planet Earth. So you must know that same side will be upper motor neuron weakness and loss of position and vibration because dorsal columns are involved. And the opposite side will be pain and temperature because spinothalamic tract basically decussates. That's the reason. So Brown sequence. Now, if the V by Q ratio is infinity, what will happen? ये तो जरा दिमाग इस्तेमाल करने वाला question है. So this question, if you answered, you have a chances of going forward. But when? If you answered the 220 correctly, 220 questions out of 300 are the questions expected by you by default. It's fine. Cauda equina should answer. ब्रेन का इस्तेमाल भी नहीं करना, कोड इक्विना लेवल में आंसर करना. वो करने के बाद नेक्स्ट स्टार्ट हाउ टू गिव द गोल्ड मेडल, ब्रॉन्ज मेडल, सिल्वर मेडल. 30-35 क्वेश्चंस रहता है उसमें. वन ऑफ द क्वेश्चन इज लाइक दिस, राइट? सो यू शुड नो दैट इन द वीनस ब्लड द ऑक्सीजन इज 40, ऑक्सीजन पार्शियल प्रेशर. कार्बन डाइऑक्साइड इज 45. हवा में कैसे रहता? Oxygen partial pressure is 150 in the air that we are breathing, and carbon dioxide is considered to be 0. Not of course in a polluted city like Hyderabad or Delhi. Now in a normal person, when the ventilated areas are also get well perfused, there is a good gaseous exchange. CO2 बाहर निकलेगा, oxygen अंदर आएगा. Then in the blood, carbon dioxide will be 40, oxygen will be 100 if the V by Q ratio is 1, where ventilation perfusion are well matched. But suppose if there is any right to left shunt, bad blood on the right side, venous blood is mixing with left side, then what will happen? The venous blood ka carbon dioxide will come and dilute the arterial blood. That's the reason carbon dioxide of the venous blood is how much? 45. Even the arterial blood also will become like venous blood, and you get CO2 of 45 and oxygen is 40. On the other side, there is perfusion, but there is no perfusion, but there is ventilation. Ventilation is there, but there is pulmonary embolism is there. There is no perfusion at all. Then what will happen? The carbon dioxide cannot go out, nor oxygen cannot come in. So there the CO2 becomes 0 and oxygen is 150, just like you have it in the air. Because in the alveolus, from alveolus it is unable to enter into the blood, no? So that is the reason. So the answer is, there will be no exchange of oxygen and carbon dioxide if the V by Q is infinity, where the ventilated areas are having nil perfusion. When will V by Q will be infinity? Ventilation has a value, but perfusion is 0. Then V by Q become infinity is what you need to basically remember. One of the question on JVP. Without that, there is no question paper in PG Medical. आप और 10 साल लिखो. These are all the common rules. 18 years, we are saying the same story to almost 2 lakh students at like you. And ultimately they all settled in life. Everyone settles, be very sure. थोड़ा एक साल आगे पीछे. Finally, everyone will join one good post-graduation. There will be a time, मेरा number आएगा. Time will be there for everybody, right? There will be a time where you give sweet packets to everybody that, oh, I got in MD General Medicine, I got in anesthesia or radiology, surgery, etc. But don't think that is the end point of life. बहुत लोग कर करके बैठ गए. To be happy, you don't need MD, right? And to be depressed, you don't need a reason. So there is a reason. Enjoy the game, enjoy the journey. That's most important. So where do you see C wave? So you all know this takes a long time. I mean, at least 15-20 minutes for me to explain. That's the reason I leave you to review. If you are on UMedico, you have a video library, or you are on anatomy2medicine.com. You have got a video library. Cardiology mein jao, JVP ka lecture. We have got a 20-25 minutes video content available, right? Please review. To be short, atria contracts and pushes the blood during the last 1/3 of the ventricular filling, and that produces the A wave, right? Then atria undergo a relaxation, and that leads to development of a descent of the pressure, which is called X descent. And whenever the atria is relaxing, what is ventricle doing? Ventricle is undergoing isovolumic contraction. Isovolumic contraction. Then the tricuspid valve will prolapse back into atria. And because of that, there is a small rise in pressure in atria and jugular vein. And that is called C wave. So C wave corresponds with the isovolumic contraction, which corresponds with the atrial relaxation. And during that time, the tricuspid valve prolapses back from the ventricle into the atria and rises the pressure in the atria. That is called as the C wave. I am too rushing. 300 is there, no? Delhi tak jana hai. Huh? So isliye I will be running little fast, but otherwise JVP is a topic that is close to my heart. Midnight also you asked me to wake up and talk about ECG, JVP, cardiology. Oh, we love to, right? Alpha waves on EEG. EEG is a most high yielding topic. Typically are seen in relaxed state. So BAT D is what you need to remember. B is beta waves, conscious. Alpha waves when you are subconscious in deep relaxation. Theta waves usually during the light sleep, and then comes the delta waves usually during a deep sleep. That's how you look at the waves. Hypovolemic shock, whenever it is there, the renal blood flow decreases and the renal afferent arteriole constricts, and that decreases the GFR. That's how oliguria will occur whenever there is any hypovolemic shock is what need to be remembered. And why afferent arteriole constricts? Because whenever you are in shock, your adrenaline rises, and raised sympathetic discharge will cause the constriction of afferent arteriole in the kidney. Renal afferent arteriole is what need to be remembered. Now, counter current mechanism in kidney. You have the high yield topic list, right? Physiology mein dekho, that list is published about 8 to 10 years back. Same list we are giving to 650 topics. Padho, sarkar. कुछ भी secret नहीं है इसके लिए, कुछ भी strategy भी नहीं है. पहला topic क्या है देखो, बोल. Nephron physiology. Right? Since the time when Akbar's dynasty was ruling this country, that is the most common topic in physiology. Physiology bole to ye question invariably comes from nephron physiology. Most high yield topic, right? So, what gives that power and strength to the kidney to concentrate the urine? There is a system in which the inflow runs parallel and in close proximity to the outflow for some distance. Right? It's like India-Pakistan partition. You have seen the movie Gandhi. Both the countrymen will be crossing the border. Like that counter current mechanism hota hai. So kaise hota? When the tubular fluid is passing, if you look at the descending limb, it is permeable to water, but not to sodium potassium chloride. So that is the reason whenever it is passing down, the water seeps out. Whereas whenever it is passing up through the thick ascending limb of loop of Henle, that is impermeable to water, and on the contrast it is having a co-transporter, sodium potassium chloride co-transporter, which pulls the electrolytes into the interstitium. Once more, when it passes down the collecting duct, there is a place where urea become actively transported. So because of the collection of the urea, sodium potassium chloride into the interstitium, by the time you come down at the tip of the renal papilla, you are having the high osmolarity, which is called counter current mechanism. So why is this required? It is required because of this mechanism, there is a osmotic pressure gradient which is being maintained in the medulla, and this high osmotic gradient will suck the water from the descending limb of loop of Henle, so that we retain the water, we don't lose the water. So that is the whole purpose of it. So what are the substances involved in this counter current mechanism? The sodium is actively absorbed along with the potassium and chloride in the thick ascending limb of loop of Henle. They are the substances. Second, water is reabsorbed in the descending limb of loop of Henle. Third, urea diffuses out from the medullary collecting ducts into the medullary interstitium. So these are the substances which are basically involved. Got it? Now, glucose is absorbed by what mechanism absorbed in intestine by what mechanism? Once more, if you look at the high yield topics in physiology, types of diffusion: simple diffusion, facilitated diffusion, active transport, passive transport, very high yield topics. It is the facilitated diffusion. Facilitated diffusion, how does it happen? Glucose comes and binds with the receptor. The moment ये bind होते ही ये pregnant हो जाता, उसका conformational change आ जाता. Then that will make the glucose to leave, and once more it comes back into the original conformation. So this is called as facilitated diffusion of glucose in the gut. Who produces insulin like growth factor? In our body, the production of insulin by the beta cell in pancreas should have some stimulating factors and some inhibiting factors. Otherwise, continuously if you produce glucose, insulin, you will end up in hypoglycemia. Right? So how does the pancreatic beta cell know that? Typically, the liver cell increases the production of insulin like growth factor 1. It is like growth hormone. Insulin like growth factor 1 has got a high affinity for the IGF-1 receptor. And when it binds to that, it will cause the phosphodiesterase to increase. And that in turn will decrease the cyclic AMP, because cyclic AMP is metabolized by phosphodiesterase. And a decrease of the cyclic AMP will cause a decrease of the release of insulin. So that is how liver will tell the pancreatic beta cell, dekho bhaiya, I don't want you to produce insulin. But when will liver will increase the production of insulin like growth factor 1? Whenever the pancreatic beta cell produces a high amount of insulin, then that high insulin will go and tell the liver cell to produce IGF-1, and that IGF-1 will come back to the pancreatic beta cell and make it to decrease the insulin production. This is how our body is a big factory. When we get fever, or when your patient gets fever, tell him this point. Our body has a great regenerative capacity. Without these medicines also, you will actually recover. 2 to 3 nights should pass, and you should support an acute patient during those dark 2 to 3 nights. Then automatically body's regenerative capacity will kick off. Got it? So that is very important. So what is prosopagnosia? Anjan marna. क्यों रे अनजान मार रहे तू बोलते ना, उसको prosopagnosia बोलते हैं. Difficulty in identifying the known fellows. If you get seat in NEET PG, your friends will say, this fellow is going to suffer from prosopagnosia. You have so many duties to attend, night duties to attend, no time to spend with your family, right? So you will end up in prosopagnosia. Who are we is a feeling you will get in one of the night duties, right? Now, transport across the nucleus is by what? This is another difficult question. You have to be a MSc molecular biology for answering this question, not a medical student. Pure guess. Yaha kuch, if you jump on this kind of questions and try to answer, I know this also, bolke, you are gone. So only know what you don't know. That is all about this thing. My examiner failed me in exam. In MBBS, I failed in anatomy and also once in SPM, 2 times put. So my examiner told, you know why? Second time when I gone, no questions, he said. I have no questions for you. Because I used to write a lot of MCQ reviews, right from my 3rd year of MBBS, 2nd year of MBBS in fact. Pathology, Robbins review and like that. Even his son used to study for the entrance exam, my professor's son. He said, you think that you know everything. That is the reason I failed you, right? At least it's a lesson that should make you feel that you don't know everything, right? Go. I have no questions, you are passed. So, NEET PG is also an exam which will test you. The moment we enter into exam hall, we think that we know everything, we should answer everything kind of a feeling. No. You should know that 50 questions are created like a quagmires. Like, right? So they are like bomb blasts. So try to drive without hitting them. That is one important thing that you should be sure about. Who will know what are rat proteins? I don't know. Koi answer, correctly answer kare to pure astrological mercy. But don't go by that mercy. Iron from enterocytes enter through DMT1. This is a favorite topic. Typically iron comes and DMT1 receptor will make it to basically enter into the cell, and this is how the iron circulation happen in the reticuloendothelial cells is what you need to be very sure about. Serotonin is also called as 5-hydroxytryptamine. Even a 9th class biology student, this is a NEET UG question actually, okay, it's a undergraduate question. Thyrosinosis is due to the deficiency of, impossible question, don't try this, if you tried it you lost 1 mark, right? It's like, do you know how to play rummy? 13 cards ka rummy, playing cards. Isme you must know when to drop the game, right? If you don't have a joker, you don't have a life, you have to drop the game. Like that is the NEET PG exam. This is another impossible question. You answered means you are ready for MD Biochemistry seat, right? So, fumaryl acetoacetate hydrolyze. So, typically when phenylalanine is getting metabolized, knowing phenylketonuria is okay, right? Alkaptonuria is okay. If you also know tyrosinemia means definitely paper out, right? So, yeah. Lashkani-Khan HGPRT. This is one of the oldest questions. Then fish-adore syndrome. Impossible question. You put any kind of perfume and go to exam hall, you can't answer this. I can bet it. So, it is a monoxygenase deficiency. In Mahabharata, there is a Matsya Gandhi. She smells like fish, right? Mahabharata serial. Huh? So, Typically, eggs, liver, legumes, brassica, vegetables, they all contain choline. So, choline typically undergo the hepatic metabolism and trimethyl amine N oxide is supposed to get metabolized. If it is not metabolized, then all the urine, sweat, breath, everything smell like a fish. That is the whole story. Of course, in medical college, a lot of our classmates suffer from fish odor syndrome, but we had a high tolerance for it. Galactosemia is because of galt deficiency. No big deal. Most abundant product of fatty acid synthesis is palmitate, palmitic acid. Then what is DNA polymerase 1? Favorite question. Check the biochemistry high yield topic list that we have given about 10 years back. 10 years back, 650 high yield topics only is circulating across the internet. Right. So, we have done an analysis of 15 years AIMS, All India, PGI, JIPMER question bank and came up with this list. Usme dekho, DNA replication polymerases is some 5th or 6th topic. Hai ya nahi? DNA synthesis, DNA replication polymerases. If you look at the list of the high yield topics in top 20, kitna number topic hai? Huh? Second high yield topic, right? I am telling you now. One question will definitely come on DNA polymerases. You have to be 100% sure. So, DNA polymerase typically is not involved in replication. It is only involved in repair the damage, and it is typically found in prokaryotes. Bacteria is what need to be remembered. Chaperones are the protein folding molecules. Even a newborn baby will answer this. One more fishy question. Fishy odor is because of deficiency of riboflavin. This is a little abnormal question. Vitamins is a very high yield topic, but this is a atypical point in the high yield topic, low yield point in high yield topic. Vinyl mandelic acid, pheochromocytoma array. These are like 1980s PG medical entrance questions, single liners. Then cystinuria mein cola will come out. What is cola? Cola is cysteine, ornithine, arginine, lysine, not cysteine. That is what you need to know. The difference between cysteine, cysteine, if you know how to answer this question. Another impossible question of NEET PG. Fibrinopeptide A and B are acidic. Why? Because they are having a glutamate and aspartate inside them. Don't try this kind of questions. Don't try to, if you don't answer that, earth and sky don't fall down. If you answer 220 questions correctly. That is the point I like to drive to you. Isliye, keep trying the mock tests. Every time you see how good you are able to guess. Some people actually are very good in guessing, right? But you are not, you are participating in a PG medical entrance, not in a horse race, right? So that's important. So don't leave things to luck. HIA is present in case of carcinoid, hydroxyindolestric acid. Then Warthin-Finkeldy is measles. Oh, we know that since many years. एक CD marker के बिना कोई भी exam नहीं होता, but otherwise CD59 in PNH is a favorite question. Decay accelerating factor it is called as. Typically, if you look at the RBCs, a normal RBC, whenever complement in the blood, every time it tries to attack, this CD59 will prevent it from getting broken. But those who have a deficiency of CD59, they are vulnerable to the complement mediated lysis. So that is the reason there will be extensive hemolysis, release of LDH and development of anemia, which is the pathophysiology of PNH. PNH is another favorite question. Many times we discussed in our mock tests. Which is an opsonin. One complement component pathway is a favorite topic. So C3b is called a opsonin. So which is the chemotactic factors, everything about the complement system you have to be sure. Burnett-Solier is GP1B. Even if second year medical student know this nowadays, right? So how does the platelet clot form? One platelet binds with another platelet with the fibrinogen in the middle. And for the fibrinogen to bind, typically you are having GP2B3A complex. If that is deficient in Glanzmann's thrombocythemia, one platelet cannot bind with the other with the fibrinogen in the middle. Then typically you are having GP1B. What does GP1B does? Platelet has to adhere to the vascular endothelium with a von Willebrand factor mediating it. So this receptor for the von Willebrand factor on the platelet is GP1B. Even if von Willebrand factor is there, if the GP1B is not there, there will be bleeding. And that is a problem in Burnett-Solier. Then if the von Willebrand factor itself is not there, you call as von Willebrand disease. Once more, von Willebrand, Glanzmann, Burnett-Solier, and within von Willebrand, what are the types of von Willebrand? How do you differentiate? What are the ristocytin factor studies? All this you have to be 100% sure when you go to the exam. Right, doc? Cowden syndrome. Typically, there will be multiple neuromas in these people, hematomas, and it is the P10 phosphatase and tensin homolog gene which is typically abnormal in them. Myotonic dystrophy chromosome. Impossible question. Don't try the lucky number. And don't say, it feels like I know this question, it feels like I know this question. It is like a typical Dracula movie, right? Or any Bhoot movie. Come, I will give you gift. Come, I will give you gift. That hallucination will be playing in exam hall. Yeah, this is just a greedy trap. Don't fall in that. So it is a chromosome 19. And just because he gave this chromosome, will you read all neurological disorders and their chromosome numbers and become a mad guy? You should not become that. Tell your friends to read that, right? Now, TRALI, transfusion related acute lung reaction, typically within how many hours? So, transfusion associated adverse effects is a favorite topic. Not very high yield, but a good topic. So there will be an acute lung injury which can occur because of the transfusion immediately within 6 hours if you rapidly transfuse, which is called TRALI. How does kidney respond to the shock? It will cause afferent arteriolar constriction is what need to be remembered. Kaiser-Fishker ring, Wilson's disease, arre Rama. If you did this question wrong, no doctor, another 4 or 5 years time lagega. You are in an amoeba stage of preparation. You know, you should, why do you take mock tests? In mock tests you should know, am I like amoeba, am I paramecium or coelenterata, platyhelminthes? Which stage of evolution of preparation am I? Right? So, it's all question of 650 topics. If you know only 100 topics, you are in paramecium stage. If you know 300 topics, you are at vertebrate stage. Finish all 650, you are a proper Homo sapien ready to attack exam. Whether it is a CBT computer exam, multiple slot exam, any exam you can complete. Now doctor, what is the epithelial tumor of a stomach? Basic question of definitions of type of malignancies, right? What are epithelial origin? What are mesodermal origin, etc. So, gastric adenocarcinoma. Habba. This is, I think, the lowest, cheapest question on the planet. Color blindness bhi X-linked बोल के मालूम नहीं है तो मेरे भाई, अब फिर first year में join होना पड़ता. So, why do you call this exam complex? Is it really complex? No, it should not be. right?